I'm Martin Sasada. I'm the consultant anaesthetist at Cosmetic surgery. Today I'm going to talk to you a little bit about the advantages of sedation over general anaesthesia for facelift surgery. Sedation has become a routine part of our practice now and has been for about the last 4 or 5 years. There's no doubt in my mind that it has very significant advantages over general anaesthesia for facelift surgery. The first point is that sedation is undoubtedly safer than having a general anaesthetic, although nowadays general anaesthesia is relatively safe. More importantly, I think, is that for patients, sedation is much better tolerated than general anaesthesia. It's associated with a much more rapid recovery and a much better quality of recovery as well. Nowadays we just really don't see any of the sort of sickness, sore throats, headaches, hangover effects that we used to when we used general anaesthesia. In fact, we haven't really used general anaesthesia for facelift surgery for about 4 or 5 years now. We are pioneers for the use of sedation for facelift surgery in the UK, and in fact many patients now come to us specifically because they want to be treated under sedation rather than general anaesthesia. We understand just how important it is to you to be able to get back on with your life as quickly as possible after having a facelift. The recovery after sedation is much more rapid than after a general anaesthetic, which is why we've incorporated it as part of our technique. Another very powerful advantage of the use of sedation is that it is associated with fewer post-operative bleeding problems than general anaesthesia is. Another factor that some patients find very important is that it's significantly cheaper to have treatment under sedation rather than general anaesthesia, and this is related to the way in which the hospital bills us for the use of its services. If you're at all unsure as to what the experience of having a facelift under sedation is like, then I would recommend that you have a look on our patient forum. There are plenty of first-hand reports of the experience there.